Now we move on to what everyone's been waiting for. 13C. Now, basically what we want is a presentation. So whoever's going to give this presentation, can you please come up? How many minutes do we allocate?
20 minutes, Mayor.
You have 20 minutes for your presentation. City Manager, do you have any introductory remarks?
I'm happy to provide a few introductory remarks, Mayor. And good evening, everyone. This is an item that relates and dates back to March 4th, 2022, when the Riverside University Health System sought the City Council's support for a grant. And there was a timing issue with this grant, and so the council did express concerns at the time about the lack of community engagement, but acknowledged that the urgency of the grant application process resulted in the council's support for that grant. When we fast forward to about a month ago, on February 28th, the City Council took action to rescind the letter of support for that grant. Following that meeting, in both the media and also meetings with city staff, public officials representing Riverside University Health Systems stated publicly that the project would still proceed. And that's really the reason we're here tonight, to prepare. And as a result, we've prepared a staff report that seeks direct intervention from the Riverside County Board of Supervisors. And a proposed draft letter is attached for your review. And it's based on the 4 primary concerns that the council expressed at your prior meeting, related to community engagement, some incompatibility with existing community plans, lack of infrastructure, and discrepancies in communications. We have invited representatives of the county to present tonight, and I want to introduce Ryan Miller, who's the Deputy Director of Integrated Programs for Riverside University Health Systems. Mr. Miller.
Well, good evening. Figure I better time myself and keep it short and to the point. Ryan Miller, Deputy Director, Behavioral Health for the county.
Hi, good evening. Melissa Noon, Administrative Services Manager with Behavioral Health.
And so just thank you for having us back tonight. I know there's been a lot back and forth, but we're glad to have the opportunity to share some of the things. Last time I was here at the podium, there was a lot of good questions from the council, the mayor, and the public at large. Hopefully tonight we can answer some of those questions that we didn't answer the first time. There was also some myths that were brought up, or at least rumors in the community. We'd like to put those to bed and move on. And the one piece I'd like to share is at least the state thinks that our city here is worthy of putting money into. As of yesterday, we did receive just under $80 million for the project for the city, which is good news for our community and everyone else. So with that, if we can go to the next slide. Hard to see, huh? So we went through it very thoroughly last time. Clicker, got it. Thank you, my friend. So we went through the slides pretty thoroughly last time we were here, at least with what each program represents. We just want to remind everyone, maybe that wasn't here the first time, this village would offer both physical health care, primary health care, mental health services, substance use disorder services, activities for the community, pharmacy, everything from mammograms, x-rays, children's services, prenatal care, and the whole piece. It'll be a state-of-the-art campus built around the community of Hemet, with the cultural influence and things, and us respecting that. I love the presentations at the beginning, by the way, and the green space. So the one thing we thought we'd bring to your attention currently is last time we were here, it did come up what services we're currently offering in the Valley. And so we did want to just bring to your attention the number of consumers that we've served in these various arenas in the last 6 months alone. If you can see at our mental health clinic, just over 1,400 in our substance abuse and prevention. This is combined not only with our outpatient clinic that you guys know of in San Jacinto, but also community providers in town, both residential SUD plus recovery residences. They're already here. Our older adult program on State Street served just over 300. And primary physical health care at our community health center, we served over 5,000 consumers. So Markedly, that's a lot of humans that we're already serving. We know the need is here. And so during the processes since we first started this journey with the city and the partnership, there are things that have come up where the city has asked for additional items. This is a list of services that we already provide, but there's a couple I wanted to point out that we added on after feedback, especially around our CBAT, our ride-along clinicians with law enforcement. We added more of those. We added a lot more crisis intervention services, mobile crisis teams that are now stationed at the San Jacinto and Hemet school districts, and a further list. Turn it over to Melissa for a minute.
So this is a kind of overview of our entire campus. We know we shared this in detail before, but we wanted to remind you again what it looks like and kind of the outline of that. All of the services that are provided are within those kind of 5 main buildings. And we'll go to the next slide and kind of take a deeper dive into what those specific programs are for. And so the community health and wellness, so we currently have one of those in the city of Hemet now. That is very old and small, and so this one will be larger, newer, obviously, and include primary care services that are not currently offered there, such as dentistry and mammogram, WIC, for our women, infants, and children, and a pharmacy as well. Our community youth services, this will include outpatient services, a short-term residential therapeutic program, crisis residential treatment program, which those 2 programs are not offered nowhere in the county of Riverside currently. So if your child, sister, brother, grandchild, anybody who needs some of those services, neighbor, need to see, a higher level of care, they would either have to go out of the county or previously we sent them out of state. Our patient and family treatment housing, those are our apartment buildings, and those include some supportive housing with behavioral health services and recovery residences. And then our urgent care and behavioral health care facility includes mental health urgent care for children, adults, and our closest mental health urgent care is currently in the city of Paris, which would take you 30 minutes to get there, assuming there's no traffic, if somebody that is experiencing a mental health crisis. That also includes a sobering center and a crisis residential treatment program. Our long-term behavioral health care includes a mental health rehabilitation center, which is, and an adult residential facility. There you go. And so this is a slide and an overview of our entire campus and kind of the campus amenities that are included in those. So it includes a community park, and so that's open to the public. It's in the outside grounds of the campus, and so we thought, we'd like to improve the community and make some, and not only include reintegration from the campus, but also community engagement as well. Trails, rest areas, gardens within the campus, an activity lawn, a grocery store that will be open to the public, a cafe, and then pet services for those individuals on the campus.
So again, our goal here, I think at least my goal, I can speak for myself, is that we get back to where we started, which was when we met with the council and the mayor originally. Maybe it's the military in me, I don't know, but I can follow direction and I can follow my superiors' guides and I can do what I'm told. And so our real fundamental understanding when we first met was we showed the architecture and what we thought would be best in this campus. We got feedback from the council and the mayor, and we set off on a journey to build it. One of those items that came up in those initial meetings in 2022 was the idea around the strategic plan, and did it not match what the city of Hemet and the constituents wanted? We find that it absolutely does. One of the great questions that was unanswered last time we were here was the idea about the creation of jobs. So we say, we're looking to create 600 jobs on the campus, and the point was brought up as, oh my God, well, we don't need 600 more county employees and all the costs and benefits go into that. That's true. These programs are not county run. Only the outpatient building where the current programs that are in the city of Hemet and San Jacinto that are moving in are county operated. The campus itself will be county operated by county staff. All the other programs will be contracted out to community-based providers. I think that's an important piece there. So Here on the next two slides, you'll see we incorporated it in. We call out what we think is part of the strategic plan. What?
So we tried to do that with, we looked at all of your goals and felt that the village aligns with what the city's community plans and goals are. And so, to manage the city's growth and protecting and preserving the environment and maximizing the use of public infrastructure, our goal of the village is to reintegrate and, people and community engagement. And so we believe that we're doing this with the public green space and the park for the community, the grocery store, and the rooms that are within the community center that will be available, to some extent to the community for use. In addition, you had all stated that you want to improve the quality of life by addressing the root cause of crime. And we know that when we provide people with the full array of our services, we see that they don't commit crime. We see that arrests are decreased by 82%, jail days are decreased by 48%, and physical health visits are increased by 24%.
So on that note, before we move on, there was some other things that were brought up around, can you show us statistics? Can you give us more information? And we can. And so in all of the packets, both the council and the mayor have and the public, there's plenty outside if you guys want to take them with you. I just want to point out that inside the packet, there is a Wellness Village fact sheet, kind of gives that quick overview for anyone that's interested. There's the PowerPoint that we're running tonight so that you can kind of go into more detail. My card is in each packet, scarily enough. And so if you have follow-up questions, I am at your disposal. There is also 4 infographics that kind of show the entire system of behavioral health, both in our children's system of care, our substance abuse, our mental health, and our eating disorders, which is very specialized. So those are in there, and those are things that are open and offered to all our Riverside County community. Then there is also a Sobering Center Arlington Recovery overview. They're one-page slides. The question came up around, the dumping ground part, which we'll get more to in a second. But you can see, especially on the Sobering Center and the ARC slide there, where we have worked so closely with Riverside City to ensure that preferential. And you can see that the percentage of Riverside residents greatly outweighs the rest of everyone that is sprinkled in. Okay, so let's talk about what the Hemet Village is not. And so this is the one where I'd love to kind of smash home some of these rumors that are out there. And so it is not a homeless shelter. And that's a rumor that we hear quite often. It is not a psychiatric hospital, and we do not do any 5150 holds on this. It is a community village for treatment. Okay, it is not a dumping ground for other counties, states, and cities. There is an authorization process to get in to be part of the campus and be assigned to whether it's physical health care, mental health care, or substance abuse care in this facility. It is also designed by that discharge process to get people back to a place of living on the outside and moving on down. It is not institutionally designed. As you saw from our longer presentation, we put a lot of thought into this, which gets back to our kind of marching orders that we took at the beginning, which was we met, we described the project, we were given direction to go out, write an RFP, which is to look for a contractor to find a designer and a builder, work that designer and a builder, and then put a master plan together after all of that and bring that back to you guys. And you'll see on our last slide where we brought that back and we're looking for further direction. Another one is being unsupervised and unsafe. This is that area where we've learned lessons in working with other cities and how we hold smaller campuses, but we will have a full 24/7, 365 security team and law enforcement. Whether that law enforcement is us contracting with the city of Hemet for police officers to be there, or whether it's with the sheriff's department. It's up to whatever you guys want to do to work with us to make that happen. But we find the combination of law enforcement and security in a team-oriented sense really keeps that safe, controllable environment so that our patients can get the most out of their treatment with us. Really quick.
And so this gives an overview of what the Hemet Village will do. And so improving the community health and wellness, we've heard our director, Dr. Chang, talk about Healthy Places Index, of which in Hemet is 6.8. It's the lowest in the entire county. This will increase the overall healthy places, create new jobs. Ryan mentioned 600 jobs. and just really increase the overall community health and wellness options for the entire community.
Yeah, and I know we're down to about 8 minutes left, 7.5. So we're gonna show you a short 4-minute, 19-second video of some of the services that we do. Then we're gonna get to the last slide, which we'll probably have lots of discussion around. If you could play that video for us.
When I first came here about 5 years ago, we saw a big increase starting with patients that were coming in with opioid addiction. And as you know, opioid addiction and opioid deaths have been rising significantly in the country, and no different here in Riverside County. So we saw a lot of women coming in, they're pregnant, they didn't know that there was any treatment available to them. So we actually didn't have one to begin with, and we just started it up because we saw a need.
The perinatal program is for any mother that is pregnant and is struggling with substances. For mothers that are pregnant and also have children, so that they can get the help that they need to change their entire life. Their kids deserve a healthy mom.
I found out about this program when I became pregnant with my third child. You know, this pregnancy was scary. I needed a doctor who knew a little bit about addiction and OBGYN, so I was referred to one of the doctors here at RUHS. Having the stigma of being an addict, I was nervous, I was scared, I felt like everyone was gonna be prejudiced and no one was gonna give me the correct care I needed.
I was worried that people would tag me as a careless mother. I tried to go to every OBGYN I could. All of them was the same. As soon as they saw my chart and everything, I wouldn't even get to see the doctor. They would honestly give me a look like judging. Made me feel very, very bad. The difference here is it was nothing like that at all.
I think that the big misconception about these women is that people think that just because they are addicted to a substance that they're not worth trying for. I don't believe that. I believe that everybody has issues. Their issue just happens to be substance use. And just because they do have that problem doesn't mean that they don't have the right to change and to be there for their children.
I kind of started sensing this pregnancy was a lot more than just being pregnant with a baby. I knew there was a lot of hope in this pregnancy.
What I loved about Dr. Shiro is that he looked at me straight in the eyes and he said, there is hope. If you want it, we're here. It's not only me, it's a group of team that are willing at your disposal if you want it. We're not here to judge you. We're here to hear you out.
We really are a collaborative environment. We do not judge. We do not care what their backgrounds are. We just want to take care of them because, after all, what most women want is to have a healthy baby.
You know, I love what I do because I'm also a recovering addict. I have 17 years clean and sober. I was pregnant and I did use substances, and I had no idea where to go, and that was 29 years ago. Since then, so much has changed, and if I can do it, if somebody like me can do it, anybody can do it. They just need to be shown how. My advice to anybody that thinks that they can't get help or there's no hope is that there is. Just get here.
While in the program, someone told me that one good decision springs off into a host of many good decisions. And coincidentally, today is the day I take my son home.
I wanted to give up, but because I didn't, I found this program. And I'm very grateful. Because if I did not, I don't think my son would be here today.
Hopefully you enjoyed that video. 2 things on the video. That ripple effect. Again, we are just looking for the partnership of the city to go through this with us together, like we had originally talked about, so that we can build something phenomenal that can be nationwide, that can be an example of care, so people can find their way home, can find their way to recovery. And so back to that part that I mentioned in the beginning about understanding our assignment and following directive, but you can see here a list, and the question was given to me last time I was here, of who have you met with? And I could not fundamentally answer your question. I wasn't prepared for that. You know, we walked into that day not understanding what had happened because we had the city's full support and we thought we were doing it together. And again, I thought I was doing, and my team was doing what we were supposed to do. As you can see by the timeline, these are the people that we've met with. And I'm going to switch. Hopefully I'll use my outside voice. You guys can still hear me. But if we back all the way up to the initial meetings, that's where the direction came from. If we fast forward, we've been to all these different meetings with supervisors, with the mayor. And what I want to point out is when we were finally ready with the plan and we had put all this work into it and hundreds of hours of work, we did come back to the San Jacinto mayor and the Hemet mayor and invited them out to do the full presentation. That happened. What we thought was going to happen after that was simply a set of instructions on who we together would go out and talk to in the community. That was the original plan, was for you to share with us where we would do it, first to the city council or open forum or however that worked. And so we were still on that path. So I just wanted you to know, bottom of my heart, it was nothing to do with not coming back and checking in with you, but the amount of work that it took to be prepared and then finding direction from both mayors to then come back to you. And then the letter, then the item of the letter being revoked came up. So just, you know, I just wanted you to know, it was not ignoring you. Now, if you can see on the list, we have some other ones coming up that are TBD, or we've already locked in a date in with the American Legion, McSweeney Farms. We recently presented 3 or 4 times in the last month. May, we have Sabova Band, Luceño Indians coming up. We have locked in a date. We have Seven Hills HOA meeting. And most importantly, we want to know if you're willing to share with us, you and the community, where you would also like us to present or what topics you would like us to present to. So with that, I'll conclude and open it up for Q&A. And again, all of this is in your packets in detail.
Thank you. Ryan, correct?
Yes.
Right. I just, you know, I just hear, you know, citizens back and forth talking about this, and I'm, you know, just, I can see what you're trying to do here, but the citizens don't want it. The majority of the council don't want it. And I know you spoke last year with 2 council members, 1 mayor and a council member, and discussed this, but the whole council wasn't involved in that conversation. And that's a problem that I see, because we should have all been brought into this originally, and we could have spoken what we believed and where we wanted to go with this. But did you even do a CEQA study on this project at all? Yes? No?
So that'll be forthcoming. We have actually...
So that's a no?
Not yet, no. So that we're not at that point of the process. And so we actually have a DRC. We submitted a DRC pre-application to the city. So we'll be meeting with your planning department later this month. And then the CEQA process, since it is county-owned land, the CEQA process will be approved by our Board of Supervisors.
You know what?
It will be approved by the Board of Supervisors since it is county-owned land.
And he's already stated he was going to approve it?
Well, it would have to go to a public hearing. Correct.
Okay, got you. Another thing, you know, you originally stated you were going to have 184 beds or 188 beds. Then you went to the water company, told them 400 beds. Then you came back to us in the last meeting, said 488 beds. So, you know, it's all across the board here. We don't even know what's coming in. By the time you finish, you might, you know, you'll put in 600 beds, and we won't have any control over that. And you know, it's just not right to us. And we have citizens that are concerned about it. And, you know, we've seen your video. The video looks good and, you know, basically shows a pretty picture, but I know in Riverside, you just had a death in your other mental health facility of a drug overdose.
That is true.
And I don't understand, if people are dying in the facility, then, how can you say it's going to be this, that, and everything else when you have people dying and your security at the other facility? I don't think you even had any type of police on site or, monitoring things on that site. So how do we know you're going to work with our police and have security there at this facility?
Understood. I do have a direct answer for you. We did some research on the numbers. There was a bunch in there in your statements, but if I could address the number of beds first, we did some research on where this discrepancy or the miscommunication between 400 and 517 come from. Would you like me to answer that first?
Yeah, what's
So in the original presentation that we did to you all here at the council, in that first original drawing, before we did the year's worth of work with the designer, there was only 400 beds. That's where that number came from. And so this is the specific number of beds. And to answer your last question on this first is, we cannot add any more beds. We have already gone through, again, the building of the rooms, the floors, everything is locked in and locked down. We can't add anything else. We wouldn't want to add anything else. But there were certain things added as we went through the process, both from feedback from community, from health workers, and things that we wanted to add. And so that's where the discrepancy came from. So the things that were added were the adult residential facility of 90 beds, and that's that long-term living facility for those with severe mental illness that cannot live in the community on their own and need special wraparound services. Importantly, the children's services were not on that original plan, and that's the Children's Crisis Residential Treatment and the STRTP for those children that need our attention, both kids and adolescents, and that totaled up to 19 more beds. The other piece was the SUD residential, increased by 14 beds, and the MHRC Mental Health Rehabilitation Center, which is the only locked facility on campus, increased by 34. That total comes to 517, and that was the discrepancy.
Well, that's a new number to me, 517. So now we bumped it up again. Huh?
We just did the math about 4 times because we didn't ourselves know where that. We heard the same back and forth on the numbers, and we wanted to at least have a concrete number for you tonight that matches to the plans that were submitted for approval to our directors and the board. You're welcome. Did you want any answers to the other questions that you had? The law enforcement, for example, or the death? Both, you got it. So the law enforcement piece, yes, we currently employ Riverside Sheriff's Department and a combination of a security team. What that security team,
When did that go into effect?
you know, in the contract for,
Because I know it wasn't there originally.
it was not there. The officer was not there originally. So it was an idea by our hospital director that we try this out. And we tried it out and we really liked it. The providers liked it. The consumers liked it. It was weird for them at first, having law enforcement be able to have badge access in and out of the building and walk around freely. But those officers that they assigned became part of that team. They became known, and it was very comfortable. We like it. We want to do it here. And that's how I feel about it clinically. It actually worked, and there was skepticism. The death that was there, yes, there was one death at the ARC itself, the residential. There are deaths every day in our residential programs across the state, across the nation. Fentanyl kills. The disease of addiction is real. That is a bottom line fact. We cannot strip search an individual that's coming to treatment on their own recognizance or own desire. As an example, we've had women sew fentanyl into their bra straps. We can't check for that. It's not jail. And it's a sad, sad situation. You know, we know this client. My staff had to go through the client's death. I get it. It is sad, but it is reality. And I would rather give the other 1,637 consumers that didn't die a chance at recovery, knowing that somebody is going to pass away. Somebody is going to OD from this drugs. And again, my heart goes out to that family and every family that's touched by the disease of addiction and mental health. But if we don't put treatment programs up, no one's going to get better, and they're going to be dying on our streets instead. So, sorry. That part, I'm in the work of human beings. So, and I think that answered all 3 of your questions.
Other council members have any questions?
Go ahead.
Thank you for being here. I do appreciate it. I've seen 3 presentations now, and none of them remain the same. And I still have an issue. You had put up all the people that you have met with in this community, but you didn't say anything about what the reaction was. Because I know most of the people that were up there, and I know what their comments to me have been, and that's that we don't want it here.
So, and we haven't received that. That's just, I mean, obviously sitting behind the podium up there in your positions that you need to fill, it's just my word. But what I can tell you is we have gotten no pushback. What we've gotten is suggestions on how to make it better as we design. The part about the children's piece is being added. It was pointed out to us earlier. What about the kids? Oh, you're right. We need to add kids services. Well, what kind of kids services are in the county? Well, there's none of, there's no STRTP, there's no CRT, there's no mental health urgent care. For those that are 0 to 12, there's only those for adolescents. So we added that. So those things we added too, the security piece, the coming and going out of the campus. These are all things that came out of those meetings as we went to make it something in a partnership to make it successful. We know it has to be successful. This is a large campus and it can do a lot of good if it's done right and we all gather around it and do it together.
And I agree with you 100%, but not in that location.
I know, I understand.
Now, when you first presented, the number of beds and services has just gone out of sight. And with adding all of this, the medical and all of the grocery store and the cafe and all of these other services, you're basically competing with private enterprise in our valley. And you're taking tax dollars out of the city by putting something like this on a piece of property that could be original zoning in our general plan, office business park and affordable housing. That's what I have a real problem with, is that you're actually harming our city from a financial outlook for the future by putting something here that is competing with businesses that are here. So how do you expect us to go along with something like that? Plus the outcry from people I know. I've gotten text messages, phone calls, and emails all day from people that couldn't be here tonight. And they say, why is the county doing this? Why are they doing this? And the next question is, what's going to happen to the buildings that are already providing these services now? They're going to get emptied. They will be empty in both Hemet and San Jacinto, which also feeds back to problems that we have with break-ins. So, decreasing crime is, it's fantastic. But when you change the law so that drug deals and shooting up on the street isn't a crime, of course your statistics are going to go down. And I know this is, I feel very deeply about this. I understand the need for mental health facilities, but not in the middle of my town. It's harmful. It has the ability to be extremely harmful and have a negative economic impact on our city.
Understood. May I comment back slightly?
Yes, absolutely.
Thank you.
And that's part of the problem that I'm having with this entire project, is that there isn't any communication until we put it on a city agenda, and then everybody has to come out here and tell us how horrible we are for saying no to this project. That's what I really have a problem with. You haven't communicated with me 3 times, 3 council meetings, and that's when you get attention. And that's it. Come and talk to us when you want to do things like this. It's our city. I know it's your land, but it's our city, and it's our residents, and it's our future. Yes, please comment, and I'll just shut up at this point.
No, it's okay. And again, I'm in a position, I'm here to do my job. That is true. But I'm also a community member, and this is our community. Together. I am not in politics and I am not in banking. I am a human service worker. I don't work for my paycheck. I work to watch lives change. And I know a lot of people in here are in that field. I feel your passion and I respect your passion. I would humbly disagree on the parts about the businesses, only because what we're talking about when we say grocery store, We are talking about a small grocery store that offers WIC, which we already have with mothers. We would be contracting out to that community provider and asking if they would come in and run that store there so mothers with children can get their WIC stuff. This is not a county-run business. And again, it's small, and for those living on campus, the pharmacy is open to the entire community if they want to use it. But the mainstay, if you look at the way it's designed, it is for those individuals to have a safe place to live, a safe place to go to treatment, and get their healthcare met. They're already getting healthcare, but unfortunately, some of them don't have a home. As a parent, if I have a choice between trying to find a roof or something to eat for my children tonight, or go to treatment to get better spiritually and emotionally and physically, I'm going to choose food for my child every single time. That's just who I am. Regardless of the cost or regardless of the laws I'm going to have to break, I'm going to go make sure my kid has food in their belly. Bottom line. We want a place where we can offer that part of it so that they know that them and their family are secure while they engage in treatment so they can move down that path to recovery. I can't tell you about the business parts of the taxes or anything else. I just, the lack of communication piece. I would love to sit with any of you and discuss. I'd love to go to your different meetings and discuss it openly, and my team will as well, just simply with a green light. And again, unfortunately, I see how it appears. The letter came up to rescind, and all of a sudden we scrambled over here. But please know that we are over here working under the assumption that after we met with both mayors and Congressman Reese's office, that they would tell us where and who to come present to and start doing the rounds in the community as was originally designed and discussed at the very beginning when we worked together to come up with the project at that location.
Just one final comment.
Yes, ma'am.
Except at that first meeting, the conversation was on homeless. And it was, I listened to it this afternoon, and the comment was made by now Mayor Males, asking the question if there would be beds guaranteed to be open for Hemet homeless, and the answer was yes.
Well, of course.
Now you're saying you're saying it's not going to be dealing with 5150s or homeless.
But to be clear, it is not a homeless shelter. A homeless shelter is a facility. If we take the one in Riverside,
I know that.
Right. And I don't know if everyone does it, but just really quick, if I could touch on it, it is not a homeless shelter, and we had that on our slide because this is not a facility that is going to let people stand in line to have a bed to sleep in for the night safely off the street and then back out to the street with no services, no food. This is designed for those people that do not have a home, that are homeless on your streets, that need to also come to treatment to get better, not just a roof over their head, so that they can get it as a package deal. So it is for homeless individuals needing mental health, physical health care, substance abuse care, and give them a place that's safe and covered while they're doing that. Otherwise, they'll never get the chance to get into treatment. So that's where the homeless piece of it comes into. But we want to make sure that everybody understands this is nothing like a homeless shelter. This is not Skid Row. This is a different style, a continuum of care into a village. Yes, ma'am. Yep.
Sorry, is it okay if I comment just on your?
Absolutely.
Okay, thank you. So we know that, you mentioned that you're concerned about closing businesses or taking revenue away. So our current community health center, which is our CHC or FQHC that will be putting on the new campus, which is larger and newer, we can't currently sustain or accommodate the need for that facility. And so we need to grow, right? Your community needs access to this care. And so we putting a larger facility in is going to be able to provide services to the community that is in need. And we're a government agency, so we're not looking to gain a profit. Our goal is not to close any small businesses or any other businesses. But we also do know, and I think we mentioned last time, that we are partnering, or we've contracted with Beacon Economics, who's doing an economic impact analysis. They're in the process of doing that now. We don't have numbers today, but we know that they've already shared that they anticipate this village will generate millions of dollars, whether it's indirectly from even the construction phase. The construction workers who are here, they're going to be needing to use local gas and food and services. And we believe also that a lot of the workforce is going to come from your city as well, which is also going to put revenue back into the city, whether it's directly or indirectly, purchasing houses or, this is really going to create an opportunity for so many on different levels.
And I think one of the things that was said last time, I believe Mayor, maybe from you, is there was nothing here. And I don't know how the comment was made, but in what I felt inside is there is something here. We are here. My kids play soccer here in Hemet in 2 different places and one in San Jacinto at least twice a month. There is something here. We are here. And to Melissa's point, the 600 jobs of creation, if we look at a radius of, how many people live locally that might come to work and open up those jobs in those communities, new businesses to help those that are already here. There are people online tonight that are providers in your community that we already fund for those people that need it. We're not trying to take business. We are not private insurance. We are not for profit. We are just trying to help the community the way that we had talked about it at the beginning.
Okay, we need to move on. Jackie, go ahead.
Okay, this is the first time that I heard that it was going to be like an open park, an open pharmacy, and an open grocery store. So I know you said before you'll have transportation for the people that can come and go as they feel. So I don't think the residents in our city are going to like this open concept. I just can't see the people that live next to this facility are going to like their kids going to the park and playing with people that are residents in that unit. So that's one of my concerns. I just don't think they're going to go for that at all. And you also said about the law enforcement. We're short of policemen now. So you are not going to get Hemet policemen to help you. I doubt very, very seriously on that. And we don't have sheriff contract here. So I don't know if you can do that and bring them into our city, because I think that's going to be a problem. As far as the jobs go, I don't see those people spending a lot of money here. They're going to live in other cities. They're going to come into our city. They're going to work. They're going to go home. So you have like this grandeur picture of all this economy for our city. I don't see it. So those are just my comments.
Yes, ma'am. So on the note of the law enforcement, that's simply a choice. Whether we're working with the city and we pay for law enforcement there through contract because it's part of the service array, or if we just simply bring in our own sheriff to do that for us. That's a choice that we would hope the city would engage with us to decide if you wanted to be your own law enforcement or ours.
Well, here's the thing. You say that something that the city would join in and discuss with you, but you haven't even discussed anything with us other than that one meeting. And then a year later, you come in and say, we're building. So you talk about discussion with the city. You haven't shown us that you can discuss things with us other than coming here and speaking with 2 of our council members and getting your ideas on what you're going to do and then going forward on it. You haven't done anything. And like you said you would at the beginning, and you would interface with us and let us know what the progress was on this building, and you haven't done that. So,
I'm a little confused how we haven't done that when we met with both mayors and asked for direction. That was, our marching orders was to come back when we are at a certain design phase to get the city's input on.
When you say both mayor, you're talking about San Jacinto and Hemet?
San Jacinto, that's who.
That was last year when you discussed this?
Yeah, and the timeline is in the packet. So,
yeah.
If we're looking for direction on our next marching steps of who to meet with, what community forums to be in, personally, I feel like we followed our directive. So,
we haven't seen it. So, anyways, we're going to move on. We thank you. Thank you for your presentation, and we're going to move on to our public comments.
I appreciate that.
Thank you.